Good morning, Michael. Another day in the OR, and we have a complex case ahead, a mitral valve repair. How are the patient's vitals looking?
Good morning, Sarah. The patient's heart rate is stable at 75 bpm, blood pressure at 120/80ths, and oxygen saturation is 98%. We're ready to proceed.
Excellent. Let's talk about the surgical plan. The patient's mitral valve has severe regurgitation, and I'm considering a minimally invasive approach. What are your thoughts on the anesthesia strategy for this case?
Given the minimally invasive nature, a balanced general anesthesia seems appropriate. I'll use a combination of intravenous anesthetics and a volatile agent to maintain the patient's anesthesia depth. This will ensure muscle relaxation and a controlled airway.
Agreed. I'll need a clear view of the mitral valve, so a relaxed and stable patient is crucial. I also plan to use transesophageal echocardiography to monitor the valve repair in real time. How will you manage the patient's hemodynamics during this?
I'll monitor the patient's blood pressure continuously using an arterial line. Inotropic support might be necessary to maintain adequate cardiac output during the procedure. I'll also keep a close eye on fluid administration to avoid any overload.
Perfect. Maintaining the patient's core temperature is vital too, especially during a longer procedure. What's your plan for temperature regulation?
I'll use a forced air warming blanket and adjust the OR temperature as needed to maintain normothermia. The goal is to prevent both hypothermia and hyperthermia, as they can impact coagulation and overall patient outcomes.
Excellent point. Communication during surgery is paramount. How can we ensure effective communication between us and the rest of the team in this dynamic environment?
We'll use a combination of verbal and nonverbal cues, especially during critical moments like valve repair and weaning from bypass. I'll also ensure that the patient's anesthesia records are meticulously documented for future reference.
Sounds like a plan. Let's discuss potential complications. If we encounter sudden bleeding during the repair, how would you respond?
If there is sudden bleeding, I'll first check the anesthesia depth to rule out inadequate anesthesia. If that's not the issue, I'll consider hypovolemia and respond with appropriate fluid resuscitation. If the patient's blood pressure drops significantly, I'll also consider vasopressor support.
Your quick response will be crucial. Now, as we approach the final stages of the procedure, how do you plan on managing the transition from bypass to normal circulation?
Gradual weaning from bypass is essential to allow the patient's heart to regain its function gradually. I'll monitor the patient's cardiac output, oxygen saturation, and blood pressure closely as we decrease bypass flow. Any signs of instability will prompt a cautious approach.
That aligns with my approach to valve repair completion. As we wrap up, Michael, I appreciate your expertise and collaboration in the OR. Our synchronized efforts are what make procedures like this successful.
Thank you, Sarah. The feeling is mutual. It's the seamless interplay of our skills that ensures the best outcome for the patient. Teamwork truly shines here.